have a follow-up from the Capitol. Lawmakers have sent two measures to the governor's desk. Both are aimed at keeping the cost of your life-saving medications low. Our Capitol Bureau Chief Cole Hankey is live in the Capitol for us tonight. Cole, this is not the first time they've tightened laws in this area.
That's right. In 2019, the state passed a law that capped the monthly cost of insulin at $100. But now they've lowered that cap again, this time to $35. And also, they've put in some extra regulations around generic prescription drugs as well. People rely on their prescriptions. In many cases, they can be life-saving, but it can be life-altering if they suddenly spike in price.
We've heard heartbreaking stories over the years of how the high cost of prescription drugs has forced older adults on fixed incomes to choose their between paying for medication or paying for other necessities like food, clothing, and shelter.
A bill that now sits on the governor's desk would work to stop price gouging on generic drugs. It would allow the Attorney General's office to take legal action if a manufacturer increases the price 30% or more over the past year, 50% or more over the past 3 years, or by 75% or more over the past 5 years. Pharmacists say this is far from a cure-all, though.
We're still not completely addressing one of the biggest aspects of the influence of the increase in drug prices, and that's the claims and pricing setting that pharmacy benefit managers have in this space.
Lawmakers also plan to lower the price cap on insulin from $100 to $35 for a month's supply. It's part of an ongoing push to make the drug more affordable.
It's a step towards lessening that burden and stress on older adults and Illinoisans that need the medications to live and survive.
Even with the governor's signature, there will still be plenty of steps to take before the difference in price is seen at the pharmacy.
That can be very frustrating, but work with your pharmacist and work with your insurance company in understanding when some of these new benefits will be available for you.
Now, these changes actually put the insulin cap in line with the regulations at the federal Medicare level as well. And these changes for the insulin price caps only apply to those that have state-sponsored health insurance plans. Reporting in Springfield, I'm Cole Hankey, WCIA 3, your local news leader.
Cole, thank you.